There's something very important I want to talk about today, and most people over 70 are never told this clearly. Every year, millions of seniors go for routine medical checkups. They do it because they want to stay safe, they want peace of mind, they want to take care of their health. And that intention is good, but here's the part that rarely gets explained. Some medical tests, especially after 70, don't always help. In certain situations, they can actually create problems that weren't there before. Not because doctors want harm, not because medicine is bad, but because aging bodies respond differently to testing, labels, and follow-up procedures. Today, I want to walk you through 5 health checkups that many people over 70 are routinely sent for, and why in the wrong situation they may cause more stress, more procedures, and less quality of life. This is not about avoiding doctors. It's about asking better questions and making informed choices. Diagnosis. A quiet problem in modern medicine. As we get older, medical testing increases, more scans, more screenings, more follow-ups. But large studies now show that a significant portion of tests in seniors lead to overtreatment, meaning results that trigger medications, procedures, or surgeries that don't actually improve daily life or longevity. In many cases, the test doesn't find a dangerous problem. It finds normal age-related changes. And once something is found, it's very hard to unsee it. That's how a simple test can turn into months of worry. Important reminder. Before we continue, what I'm sharing today is general information. Every person is different. Symptoms matter, medical history matters, but if you feel well, function well, and live independently, it's reasonable to pause and ask, do I really need this test? What happens if we don't do it? What are the next steps if something small shows up? Those are powerful questions. Now let's begin with the first checkup. Number 5. Bone density scans. After 70, bone density scans, often called DEXA scans, sound very reassuring. No pain, no needles, no recovery time. They measure bone thickness and are often used to screen for osteoporosis. But after age 70, these scans often create more anxiety than clarity. Here's why. Bone density naturally decreases with age. Almost everyone over 70 will show some degree of bone thinning, even healthy active people. That number alone doesn't always mean bones are fragile, but many seniors are quickly labeled and started on medications that may not provide meaningful benefit. When the label causes more harm than help, medications, commonly prescribed after bone scans, can irritate the digestive system, affect jaw health, and in rare cases weaken bone quality over time instead of improving it. Large studies show that in people over 70, without frequent falls or fractures, treating mild bone loss often does not significantly reduce fracture risk. What does help? Strength training, balance exercises, correcting vitamin D deficiency, proper nutrition. These approaches reduce fall risk, which is the real cause of most fractures. A scan number doesn't tell you how steady you are on your feet. Your daily movement does. A more thoughtful approach. If someone over 70 is active, stable, and not experiencing falls, focusing on strength, balance, and nutrition often brings more benefit than medication triggered by a scan. The scan itself isn't dangerous, but what comes after, it sometimes is. That's why this checkup deserves careful consideration. In the next part, we'll talk about a test that creates fear in many seniors. Brain scans for memory concerns, and why they often raise alarms without improving clarity. Number 4. Brain MRI for mild memory changes. Let's talk about memory. After 70, almost everyone notices some changes. Names take longer to come. Keys get misplaced. Words don't always appear instantly. And the moment that happens, fear shows up. Fear of dementia, fear of Alzheimer's, fear of losing independence. So many doctors respond quickly by ordering a brain MRI. And that sounds responsible. But here's what most seniors are never told. In people over 70 with mild memory complaints, brain MRIs rarely give helpful answers. Dr. Sucks. What brain MRIs usually show. After 70, most MRIs in older adults show things like mild brain shrinkage, small white spots, age-related vascular changes. These findings are extremely common. They are part of normal aging for many people, but once they're written in a report, they sound serious. Words like lesions, changes, abnormalities create anxiety, even when they don't explain memory problems at all. Thedra, the domino effect of fear. Here's where the real harm can begin. An MRI finding often leads to more scans, specialist referrals, invasive tests, long-term anxiety. And none of that necessarily improves memory. In fact, anxiety itself is one of the biggest causes of memory decline in older adults. Stress shrinks attention, poor sleep worsens recall, fear makes thinking slower. So sometimes the scan meant to reassure actually accelerates the problem. Dr. Cyril, a smarter first step. For mild memory concerns, the most useful starting point is often simple cognitive screening. These are short tests done in the clinic: memory, attention, reasoning, language. They show how your brain functions, not just how it looks. Combined with sleep evaluation, medication review, hydration, hearing and vision checks, they often explain far more than an MRI ever will. Brain scans should be reserved for psychiatry. Red flags. Sudden personality change, rapid decline, seizures, new neurological symptoms. Without those, imaging often adds noise instead of clarity. Lagostas, number 3, cardiac stress tests in low-risk seniors. Next, let's talk about the heart. Cardiac stress tests are extremely common after 70. Sometimes they're ordered for mild fatigue, vague chest sensations, routine checkups, just to be safe. But here's the problem. In seniors, without clear heart symptoms, stress tests are notorious for false positives. Derisi. When a test finds a problem that isn't one. As we age, arteries naturally stiffen, heart rhythms change slightly, blood pressure responds differently to exertion. Stress tests often interpret these normal changes as danger. That leads to invasive angiograms, contrast dyes, stents, or procedures. And in many older adults, these interventions do not improve lifespan or daily function, but they do increase risk: kidney injury, bleeding, hospital stays, medication complications. The question that matters most before a stress test seniors should ask: will this test change how I feel or function? If it's positive, what's the next step? Do I have symptoms that clearly suggest heart disease? If there is, chest pain with activity, shortness of breath on exertion, significant exercise intolerance, then testing makes sense. But if someone is active, walking comfortably, and symptom-free, aggressive testing can open doors that don't need to be opened. Often, a resting ECG or careful symptom monitoring is safer. Dr. Sir, number 2, colonoscopy. After 70. This one surprises many people. Colonoscopy has saved lives. There's no doubt about that. But after age 70, and especially after 75, the balance changes. Checkups. Why colonoscopy risk increases with age. The preparation alone can cause dehydration, dizziness, electrolyte imbalance, kidney stress, sedation, affects older brains differently. Recovery takes longer, complications become more serious. And here's the key point: colon cancer usually grows very slowly. Many polyps found after 70 would never cause harm in a person's lifetime, but removing them can cause bleeding, perforation, hospitalization. Safer alternatives exist for healthy seniors without symptoms. Non-invasive stool-based tests are often safer. No sedation, no prep, done at home. They still detect concerning signs and avoid unnecessary risk. Screening should always be individualized. Age alone doesn't decide, but health status and life expectancy matter far more than habit. Number 1. Annual full-body CT scans. This is the one that worries me the most, because it sounds modern, it sounds advanced, it sounds proactive. Full-body CT scans are often sold as peace of mind. Catch everything early, scan everything at once, no symptoms needed. But after 70, this is one of the most dangerous checkups you can do without a clear reason. Number 2. The radiation problem. CT scans use ionizing radiation. A full-body CT exposes you to the equivalent of hundreds of chest X-rays in a single session. And here's what most clinics don't explain clearly. Radiation damage accumulates. Your body does not reset after a scan. For older adults, DNA repair mechanisms are slower. Cells are more vulnerable, and repeated exposure raises cancer risk, not lowers it. Large population studies now estimate that up to 1 in 20 cancers may be linked to medical imaging exposure. That's not prevention, that's risk. Number 2. The bigger trap, incidental findings. But radiation isn't even the biggest issue. The real danger is what doctors call incidental findings. Tiny nodules, small cysts, minor calcifications, things that are very common after 70 and usually harmless. But once they're seen, they can't be unseen. That triggers repeat scans, biopsies, referrals, anxiety, procedures, and many of those procedures carry far more risk than the original finding ever would. When checking everything becomes harm, here's the hard truth. Finding more does not always mean living longer. In older adults, aggressive investigation often leads to overdiagnosis, overtreatment, complications, loss of independence. Medicine works best when it is targeted, not scattershot. If you have symptoms, imaging makes sense. If something changes suddenly, imaging makes sense. But scanning the entire body, just in case, is not wisdom. It's gambling with your health. Number 3. The pattern you should notice. Let's step back for a moment. What do all 5 of these checkups have in common? They sound responsible, are often routine, trigger more testing, rarely improve daily life after 70, and most importantly, they shift focus away from function and toward fear. Number 1. What actually protects health. After 70, real prevention at this age doesn't come from more scans. It comes from strength, balance, sleep, nutrition, connection, movement. Falls prevention saves more lives than scans. Muscle strength predicts survival better than cholesterol numbers. Social engagement protects the brain better than imaging. None of those require radiation, sedation, or fear. Number 3. The most important question to ask your doctor. Before any test, especially after 70, ask this. How will this change what I do tomorrow? If the answer is unclear, pause. Also ask, what happens if we do nothing? What are the risks of the follow-up? Are there safer alternatives? A good doctor will welcome these questions. A rushed system may not, but your body is not rushed. Number 4. Final thoughts. Medicine is powerful, but more medicine is not always better medicine. After 70, the goal shifts, not chasing numbers, not hunting shadows, but protecting independence, clarity, comfort, dignity. Sometimes the healthiest decision is to say, not now, not necessary. Let's watch, not rush. If this video made you think differently about health checkups, that's a good thing. And if you or someone you love has ever gone through a test that caused more harm than help, you're not alone. Many seniors are tested too much, not because it's best for them, but because it's routine. Tell me in the comments, have you ever questioned a test, but felt pressured to do it anyway? And if you want more calm, science-based guidance like this, stay with us. Because good health after 70 isn't about doing everything. It's about doing the right things, at the right time, for the right reasons.